In 1998, while walking through the slums of Delhi, I witnessed a harsh reality: mothers struggling to feed their children, adolescent girls burdened by societal norms, yet brimming with dreams, and families resigned to poor health as their fate. My heart broke, and I knew I had to act. That's when Sukarya was born, not just as an organization but as a movement of hope, empowerment, and change. We began with a few like minded people who shared my dream of giving back to society. I envisioned Sukarya as a catalyst for transformation, an organization that empowers people rather than simply providing for them. Our mission was to enable women, children, adults, and girls to take control of their health, lives, and to reform societal attitudes towards healthcare and well being. In the early years, we organized health camps in Delhi slums, reaching vulnerable communities with free diagnostic treatments. Despite limited funding, we were driven by belief that small steps could make a big difference. Our team of doctors and health experts from esteemed institutions played a crucial role in these interventions, ensuring that we could deliver life-saving care to those who needed it most. In 2003, we established our office in Gurugram and expanded our efforts to the villages and slums of Haryana. Here, we encountered alarming health indicators: rampant anemia, unsafe childbirth practices, neglected women's health. This led us to focus on reproductive maternal child health and nutrition, addressing issues like clinical care, family planning, nutrition, and empowerment. Through our RMCHN program, we train community health workers from the villages we serve to provide personalized doorstep healthcare. They focused on safe pregnancies, breastfeeding, hygiene, and nutrition. Our monthly health clinics offered antenatal and postnatal care, anemia detection, newborn care, growth monitoring for children. This holistic approach empowered women and adults and girls to rise above the barriers and lead healthier lives. To empower women to take charge of their lives, we launched our Women's Economic Empowerment Program. It started humbly with a small group of women producing cereals and spices in our office. Today, this program has empowered over 5,000 rural women through self-help groups and entrepreneurship training. In 2007, we began working in Mewat, currently known as Nu, recognized as India's most underdeveloped district by Niti Aayog in 2018. We implemented comprehensive health clinics, engaged men in health discussions, trained community health workers, and conducted behavioral change communication campaigns. These efforts, tailored to Mewat's cultural, socio-economic context, set a standard for community-driven change. While working in the slums, we noticed that many children were out of school with little hope for education. In 2014, we launched our Education on Wheels program to provide non-formal education to slum children who had never attended school or dropped out. Our mobile classrooms bring learning directly to their doorsteps. Since its inception, the program has already reached 3,000 children, breaking the cycles of poverty and fostering a culture of learning and aspiration within marginalized communities. In 2017, Sukarya introduced its gender equality program, empowering young girls to challenge traditional gender roles and pursue their dreams. This initiative has reached over 23,000 girls, fostering leaders committed to creating equitable communities. Sukarya's leadership extends beyond grassroots efforts. Through 3 international conferences on maternal and child health, adolescent health, and nutrition, we have brought together global experts to address pressing challenges such as anemia, malnutrition, and sustainable food systems. These platforms reflect our commitment to innovation, knowledge sharing, and collaborative action. In 2024, we initiated a pilot project focused on social and behavioral change communication to address critical issues affecting adolescents. This project equips young people with essential knowledge and life skills in areas such as nutrition, mental health, sexual and reproductive health, hygiene. Over the past 27 years, Sukarya has reached more than 7.5 million women and children living in more than 790 villages and 210 slums by partnering with individuals, funding agencies, and corporations through its multiple project implementations in Delhi, Haryana, Rajasthan, and Uttar Pradesh.
The dedication and contributions of Sukarya have been widely recognized. In October 2020, US Congressman Adam Smith honored Meera Satpathy for her impactful work as a changemaker driving social transformation. In 2024, Sukarya was ranked among the top 10 trusted NGOs at the Fortune Leadership Awards. Further, in March 2025, Meera Satpathy was recognized as a runner-up in the healthcare and sanitation category at the Forbes India We Serve India Awards for her outstanding contributions. In August 2025, she was also honored with the Times Now Amazing Indian Award in the category of Girl, Child and Women's Rights Empowerment. These recognitions reflect Sukarya's unwavering commitment to improving lives and building healthier, stronger communities.
With your continued support, we can empower underserved communities, transform lives, and create a healthier and more equitable future for all.